Is depression normal? Who needs it? Who wants it? While going through a second day of depression, with life seemingly meaningless and without any hope, I turned to AI for help. My depression usually lasts 3 days and comes monthly sometimes. Sometimes it comes every other month. I feel it coming on the first day by waking up with the blahs. The blahs is how I describe the feeling of not being interested or happy about anything. Life seems dull and unenjoyable. Now I must state that I rarely jump out of bed singing with a grin on my face, and hate the sound of the alarm clock. But I know once I get going things will get better. So day 2 is always the worst for me, leaving me almost debilitated. Depression is different from just having a bad day or a bad time. It's a mental pain which is hard to describe. It's a major cause of suicides. You will want to hear what AI thinks about depression. So here's my question to AI. Based on the information that you access, will you please answer these questions about depression? 1. Is depression normal? 2. How long should or will it last? 3. At what point should I seek medical help? 4. How to help myself get out of it? Lastly, is there any benefit in depression? I have to admit AI is very polite when it answers. So AI answered in this way. Of course, I'd be glad to provide information about depression based on the knowledge I have up to September 2021. Please keep in mind that individual experiences with depression can vary. It's important to consult a qualified healthcare professional for personalized advice. Is depression normal? Depression is a common mental health condition. It's estimated that millions of people around the world experience depression at some point in their lives. Occasional feelings of sadness are a normal part of the human experience. Clinical depression, however, involves more persistent and intense feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It's important to recognize that depression is a medical condition and not just a temporary emotional state. How long should or will it last? The duration of depression varies from person to person. Some individuals may experience a single episode of depression that lasts for a few weeks or months. Others might have recurrent episodes over their lifetime. If left untreated, depressive episodes can last longer and become more severe. Timely intervention, such as therapy and/or medication, can help shorten the duration of depressive episodes and prevent future ones. At what point should I seek medical help? It's recommended to seek medical help if you're experiencing symptoms of depression that interfere with your daily life, or interfere with relationships, work, or overall well-being. Some signs that may indicate the need for medical attention include 1. Persistent feelings of sadness, hopelessness, or emptiness. 2. Loss of interest or pleasure in activities once enjoyed. 3. Changes in appetite or weight. 4. Sleep disturbances, insomnia or excessive sleep. 5. Fatigue or lack of energy. 6. Difficulty concentrating or making decisions. 7. Thoughts of death or suicide. How do I help myself get out of depression? While self-help strategies may not replace professional treatment, there are steps you can take to support your well-being. 1. Reach out for support. 2. Talk to friends, family, or a mental health professional about what you're experiencing. 3. Engage in physical activity. 4. Regular exercise can have a positive impact on mood. 5. Practice good sleep habits. 6. Prioritize getting enough quality sleep. 7. Eat a balanced diet. 8. Proper nutrition can play a role in mental well-being. 9. Mindfulness and relaxation techniques. Practices like meditation and deep breathing can help manage stress. 10. Engage in activities you enjoy. 11. Even if you don't feel like it, doing things you used to enjoy can help lift your mood. Is there any benefit in depression? Depression itself is not beneficial. It's a serious medical condition that can significantly impact a person's quality of life. However, some individuals who have experienced depression report that it has led to personal growth. It has increased empathy, and a deeper understanding of themselves and others. This doesn't mean depression is a desirable experience, but some people find meaning and insight in their recovery journey. Remember, seeking professional help is crucial if you're struggling with depression. Mental health professionals can provide appropriate diagnosis, treatment, and support tailored to your individual needs. There is no specific number of days that can universally determine when depression becomes abnormal or when you should seek help. Depression is diagnosed based on the presence of specific symptoms that persist for a certain duration and significantly impact your daily life. Generally, these symptoms should persist for at least 2 weeks before they are considered indicative of a major depressive episode. It's important to focus less on the number of days and more on the intensity and impact of your symptoms. If you're experiencing a persistent and pervasive low mood, or loss of interest or pleasure in activities, changes in appetite or sleep, feelings of hopelessness, worthlessness, or thoughts of self-harm, and these symptoms are interfering with your ability to function and enjoy life, it is advisable to seek help from a mental health professional. They can assess your situation, provide a diagnosis, and recommend appropriate treatment options. If you're ever in doubt or feeling overwhelmed, don't hesitate to reach out for support. It's always better to seek help sooner rather than later when dealing with mental health concerns. I am always amazed at the input from AI. So I pushed a little more and asked about the spiritual aspect. Here's my question. Does your knowledge indicate any spiritual aspect or spiritual benefit to depression? Can there be a spiritual cause? As usual, AI is quick to respond and said this. The relationship between depression and spirituality is complex and can vary widely based on individual beliefs and experiences. Some people may find that their spirituality or religious beliefs provide them with comfort, hope, and a sense of meaning during times of depression. Others may struggle with questions of faith or find that their depression affects their ability to engage with their spiritual practices. In some cases, people might view their depressive experiences as a part of their spiritual journey, believing that suffering can lead to personal growth, self-discovery, and a deeper connection with their beliefs or higher power. However, it's important to note that attributing depression solely to spiritual causes, or considering it as a benefit, can be misleading and potentially harmful. Depression is a complex mental health disorder with multifaceted causes, which include biological, psychological, and environmental factors. While there might be instances where spiritual beliefs or practices contribute positively to one's coping mechanisms, you must remember that depression is primarily recognized as a medical condition, and that it often requires professional medical and psychological interventions. If you or someone you know is struggling with depression, seeking help from mental health professionals is recommended. They can provide appropriate assessment, support, and treatment that is tailored to the individual's needs, and help navigate the complexities of depression in a holistic manner. Thanks AI for adding some insight into the condition. By all means, if you or someone you love is suffering, the solution is to seek help.